I would like to ask Dr. Epstein to introduce Dr. Trevor Hancock.
Thank you and good morning and welcome everybody. On behalf of the Center for Integrative Medicine, I'd like to welcome you. Thank you for joining us here this morning. I would also like to thank the organizing committee for all of the careful work that goes into planning these events. And finally, I would like to thank Betty Ann and Wade Heggie for the support, the vision, and the inspiration to make this event possible. The Heggie Lecture in Integrative Medicine, we're now in our 14th consecutive year. Integrative medicine is now being taught in virtually every medical school in Canada and the US. And the stated purpose of this lecture has been to bring high-profile, knowledgeable, and experienced physicians to the College of Medicine to address current topics in integrative medicine. And right from the get-go, 14 years ago, what we've always tried to do is to provide a platform for people with ideas who have the potential for really moving the needle with respect to the big health challenges facing humanity in the 21st century. And I can't imagine anyone who meets that criterion more than our speaker for today. Dr. Trevor Hancock is a public health advocate from Victoria, BC. Before retirement, he was professor, senior scholar, School of Public Health and Social Policy at UVic. His interests have been environmental impacts on health and green hospitals. He's been consultant for many different levels, local communities, provincial, national, NGOs, and the World Health Organization. And he's really been a pioneer in the healthy community movement. He co-founded the Canadian Association of Physicians for the Environment and the Canadian Coalition for Green Healthcare, and he was also the first leader of the Green Party of Canada. He is on the Canada Council on the Social Determinants of Health, Board of the Child and Nature Alliance of Canada, and Advisory Council of the Arts and Health Network of Canada. He was recently made in 2015 an honorary fellow of the Faculty of Public Health in the United Kingdom. And 2 years later, he was awarded the De Vries Medal, which is the highest award for outstanding achievement given by the Canadian Public Health Association. Thank you so much, Dr. Hancock, for joining us. Please join me in welcoming Dr. Trevor Hancock.
Well, thank you, Michael, and good morning to everybody. It's a pleasure to be here, and I'm very grateful for this opportunity. I am speaking to you from the unceded or improperly ceded territories of the Lekwungen-speaking peoples, particularly the Esquimalt and Songhees nations, otherwise known as Victoria in BC. And I'm going to be giving you a set of ideas about integrative medicine that is perhaps at a larger scale than is usually the case. So I am just going to share my screen, and I'm going to be moving fairly swiftly through a set of ideas that I want to share. And I do move fast in my presentations, but the PowerPoint will be available to you afterwards. So my title pretty much says it all: Planetary Health and One Planet Healthcare, Integrating the Ecological Determinants of Health within Medicine. And as Michael said, that has been really my main focus for the last 40 years, that and healthy communities, both of which I will discuss. I was once asked to give a talk about my career path by the Canadian Public Health Association, and I entitled my talk Not So Much a Path as a Ramble. And that's pretty much what I'm going to be doing with you today, is a bit of a ramble through my own history and ideas. But the question I really want to ask, and we'll come back to at the end, is what is truly holistic and integrative medicine in the 21st century? And what is involved in an approach to health and medicine that integrates the planet into medicine and medicine into the planet? So I hope I can stimulate some thoughts and ideas, and we will have time for questions at the end. This presentation is about 40 minutes. We're running about 10 minutes late, but I hope that we can have that extra 10 minutes at the end to allow for some time for questions. So I'm going to cover 5 main themes: the Mandala of Health, which I will come to in just a minute, planetary health, the notion of one planet communities, the notion of and that will include a reference to one planet healthcare systems, the notion of a well-being society, and then at the end I want to talk about rediscovering a sense of reverence for and connection with nature, which I see as one of the fundamental value shifts and conceptual shifts we need in order to make all of this work. And I think that fits in with some of the thinking around integrative medicine. So let me go back to what was for me the beginning. And that was in the late 1970s when I was working as a family physician in a community health center in Toronto on the lakeshore. And I was interested in what was then called holistic medicine. And we've since seen it described as complementary and more recently integrative medicine. And I went to some of the early meetings of what was to become the Canadian Holistic Medical Association. I was interested in some of that thinking and ideas. And I have never forgotten the day that about 15 of us sat around in a room in Toronto, and each person was asked to talk about their ideas around holistic medicine. And everybody, as we went round the room, would say body, mind, spirit, body, mind, spirit, body, mind, spirit, until it came to me. And I said, body, mind, spirit, family, community, city, society, planet. And I kind of looked around and I thought, oops, I'm not really in the same ballpark. Not long after I left family medicine and went into public health and have been concerned more with the health of populations than the health of individuals ever since. But I do have those 4 years of family medicine, which very much shaped my thinking nonetheless. And my thinking is basically holistic. And that's also why I related to the notion of holistic medicine. And Jan Smuts, the South African general and leader, wrote a book called Holism and Evolution way back in 1926, almost a century ago now. And of course, the idea of forming wholes was not new. Aristotle had written about it thousands of years ago. But it is the tendency in nature to form wholes that are greater than the sum of the parts through creative evolution. And in many ways, that's what we're trying to do right now in trying to address some of the challenges of planetary health that I'll be coming to, is how do we create something that is greater than the sum of the parts? And how do we have an evolution to a new way of thinking and living? So not long after that, I did my master's in public health at U of T, and then I moved to the city of Toronto, where I was initially the health planner in something called the Health Advocacy Unit, and subsequently became an associate medical officer of health for the city. And I was working with my dear friend and colleague Fran Perkins, who was a senior public health nurse, and we had been tasked with explaining the new public health that the city of Toronto was starting to implement following a report called Public Health in the 1980s. And we were trying to explain what public health was. And so we came up with a teaching tool that we called the Mandala of Health, because a mandala is a circular symbol of the universe. And in our case, we created what we called a bio-psycho-socio-environmental model of health. Or if you like, a model of the human ecosystem. So this was our approach to explaining it. And I'm going to run you quickly through that mandala because it really has been in many ways the basis of much of my thinking. So it begins with body, mind, and spirit. At the center is an individual person, and it's all about their body, mind, and spirit. But we know that that person lives within both usually a family unit of some sort for most of their lives, and they live in a home, a physical place where they and their family live. And we identified 4 big themes that impact directly on family and on individual. So starting bottom left with human biology, and personal behavior, but then what we call the psychosocioeconomic environment, that is to say, the immediate psychosocial environment and socioeconomic environment of the family, their level of poverty, family dynamics, all of that sort of thing. And then obviously the physical environment of the home itself. A home is both a physical environment, but also a social space. But we're focused there on the physical environment. We identified some aspects of our lives that affect different parts of this. And importantly, what we identified on the left is what we chose to call the illness care system, which is almost exclusively concerned with human biology and personal behavior and the psychology that goes with all of that. Lifestyle, we said, is not simply personal behavior. It's personal behavior as modified by your psychosocial environment and your socioeconomic environment. And then work is very much about the social experience of work and the physical environment of work. And so some of those are the big themes that operate in health promotion and public health that we wanted to get into the model. But all of that then exists within both a community, which is often a spatial community if you're talking about homes and families, but also is a non-spatial community, and within a largely human-made environment. And in fact, one of the things that subsequently I've talked about a great deal is that in North America, we are 80% urbanized and we spend 90% of our time indoors. And so the built environment of home and community are hugely important factors affecting our health. But then all of that exists within an even larger frame of reference, and that is both the culture that we live in our case, largely a Western industrialized culture rooted in the Renaissance and the Enlightenment and all that came since. And of course in the biosphere, which is ultimately planetary. So that is the context within which our health is shaped. And so that person at the center, their body, mind, and spirit is shaped by all of this. I also like to point out that while we spend 80% of our time in built environments, in neighbor communities, community environments, and 90% of our time indoors, we spend 100% of our time living within natural ecosystems. And so our natural ecosystems and our culture are the ultimate determinants of health. Human ecology, incidentally, has been defined, and one of the definitions of it is it's about the interaction of culture and environment. So this is why we then started to think of this as a model of the human ecosystem, a model of human ecology. Also, one of the things we realized as we developed this is the top half of the model is largely the social sciences, and the bottom half of the model is largely the natural and physical sciences. And so this model also integrates those. So this was the Mandala of Health. We developed this in about 1983. We published it in 1985. It's been used by a number of people over the years, and I still go back to it in my head quite a lot. So in the context of that then, what we could call our health system is a set of nested systems with the body, if you like, at the center. And on the left, I would say, is largely the realm of healthcare and medicine, everything from atoms, or for that matter, radiation, through to organs. And on the right is the realm of, I should have said, family and population and public health. So starting with family and working all the way up to planet. And obviously what we want is to integrate all of that. And that model was an attempt to try to do that. But it is a set of nested systems. That's one of the other points about this model, is that these are a set of nested systems from individual all the way out to planet. So I also have come to realize, or I think we did at the time, but even more so more recently, that this has some important similarities with indigenous models of health. This is from the First Nations Health Authority, which is the first indigenous health authority in Canada. And this is their perspective on health and wellness. And in this larger version of the model, you can see at the center again is the human being surrounded by, in this case, issues of wisdom and respect and relationship and physical, emotional, spiritual, and mental well-being. But outside of that is family and land and community and nations, and out of that is environmental, social, economic, and cultural environments. So there are many similarities between the way that we thought of the Mandala of health and the way that Indigenous people for many millennia have thought about health and practiced health. So that's the first thing, is just the conceptual model I have in my mind when I then go on and talk about things such as planetary health. So this year on World Health Day on April 7th, the theme chosen by WHO was Our Planet, Our Health. And they said in that they would be focusing on keeping humans and the planet healthy and creating societies focused on well-being. And that's where I want to spend the rest of my time, is talking about these ideas of healthy planets and well-being societies and their relationship to each other. So welcome to the Anthropocene, a new geological epoch, a new geological phenomenon. But it isn't just geological. The Anthropocene is an ecological phenomenon. So the new layers that are being laid down and that will be the rocks of the future, which contain human products such as rubber and cement and plastic and persistent organic pollutants and raised levels of carbon dioxide, future geologists will be able to detect the Anthropocene just as we can detect geological layers and epochs. But it represents an ecological phenomenon of massive and rapid global change, and ultimately it's a human phenomenon. We are the anthropos in the Anthropocene, anthropos being the ancient Greek word for human. And more precisely, some of us, those of us with high income countries and high income lifestyles, are much more the anthropos than others in terms of bearing the responsibility for what we have been doing to the planet. Because the Anthropocene represents more than just climate change. We have ongoing ocean acidification. We have depleted the ozone layer. The only good news is that we've started to repair it by banning the products that cause it, the fluorocarbons and so on. We have been depleting both renewable and non-renewable resources. We have been massively polluting the planet, and I will come back to that. But in particular, I want to flag the phenomenon of ecotoxicity. We are today, or children today, are born with a body burden of persistent organic pollutants. We don't know what that means, but nobody thinks it's good, and it's been happening since the Second World War. And finally, the sort of final common outcome of all of this is species extinction. We have entered a sixth great extinction. And all of this is happening at the same time, and altogether this constitutes an existential challenge. So this is the challenge we face, and it's a massive challenge to health. And it is both the scale and the rapidity of this change that matters. But I don't see our politics and our policies and our practices reflecting this reality. So a part of my work is how do we get people to talk about this and acknowledge it? We're not going to act on it if we don't acknowledge it in the first place. These are just some key indicators. In my slideshow of my full presentation, there are explanations a bit more for each of these. But the ecological footprint, which is our use of biocapacity per person, we exceeded the planetary boundary of the ecological footprint in about 1970. That's the green dotted line. And we currently use about 1.7 planets worth of biocapacity, much of which is carbon. That's that gray mass at the end. The Living Planet Index, top right, which measures populations of vertebrates, about 4,000 species, about 20,000 monitored populations around the world, has declined 68% since 1970. We have crossed on the bottom left already some planetary boundaries. That's the red zones, and we're approaching planetary boundaries in a zone of uncertainty and increasing risk for other areas such as climate change and land system change. And all of that has happened extremely rapidly. On the right, all of the kick-ups, or the push-ups of the hockey stick, if you like, that you see in those different charts of Earth system trends, much of that has happened since 1950, which is the dotted line in each chart. And so we have seen this massive and rapid increase in change, ecological change, driven by us, driven by three powerful forces. I was born in 1948, so when we talk about the Anthropocene beginning in 1950, that's me. I was born then. Global GDP since I was born up until 2016, which is the latest data I had when I put this together, has grown 11-fold. Population has grown 3-fold in that same time period. And all of this is even further magnified by the power of our technology. So we have got massive, powerful forces driving this massive and rapid change. And all of this has implications for health. So this is what we called in a report that I led 7 years ago now for CPHA. This is the ecological determinants of health and the notion of planetary health. So these are two reports. One is actually a discussion document on the left and a background report. We called it the report in brief because although 100 pages, we actually had a longer version, 500 pages, which we never fully completed and published. But these are both available through the Canadian Public Health Association. What we wanted to do was to introduce into the conversation about determinants of health, the ecological determinants, because they had been sadly neglected throughout the last 30 or 40 years as we focused largely on the social determinants in terms of big upstream factors, but we missed out largely the ecological determinants. And yet, when you look at it, we depend on ecosystems for the very stuff of life, for air and water and food and fuel and materials and protection from UV radiation, the natural systems that recycle our wastes and detoxify them for the most part. And of course, we've lived for the last 11 or 12,000 years within a relatively stable and livable climate that we are now disrupting. So all of these are the ecological determinants we depend upon for our health and well-being globally and nationally and locally for that matter. And many of them are being pushed to their limits. About the same time we were writing our report, the Lancet had been the editor of the Lancet had been developing the concept of planetary health, and the Rockefeller Foundation joined with the Lancet to establish a commission on planetary health. And their report, which came out about the same time as ours, and we were talking to them as we went along, was on the health of human civilization and the state of the natural systems on which it depends. So that is what planetary health is all about. So the state of those natural systems is crucial. And what we face, as the UN Secretary General Antonio Guterres said in June of this year, just a couple of weeks ago, at an event commemorating the first UN conference on the environment 50 years ago in Stockholm, he said, we face a triple planetary crisis, and it is caused by the climate emergency, by biodiversity loss, and by pollution and waste. And I'll come to each of those briefly in terms of their health impacts, but it is this triple crisis we face, not just climate change. Clearly, climate change is massive. WHO has called climate change the greatest threat to health in the 21st century and has said so for at least a decade now. This was an editorial published in 230 leading medical journals around the world to coincide with the COP26 in Glasgow last year. The greatest threat to global public health is the continued failure of world leaders to keep the global temperature rise below 1.5 degrees C and to restore nature. So if you're concerned about the health of and well-being of your patients and of your communities and of the population, then you need to be taking this very seriously. Secondly, deaths due to pollution. An estimate by WHO based on a Lancet Commission on Pollution and Health and other sources is that pollution is responsible for an estimated 9 million premature deaths in 2015. That was 16% of all deaths worldwide. 90%, 92% actually, of those deaths occur in middle and low-income countries. And note that this is 3 times more than the combination of deaths from AIDS, TB, and malaria, and 15 times more than from all wars. And another way of putting this in perspective, COVID globally has killed around 5 or 6 million people, probably more than that, but we know that's the estimate, is 5 to 6 million people over 2 years. This pollution kills 9 million every year. So you're looking at something that at least theoretically and statistically is 3 to 4 times as bad as COVID every year. We don't, again, take it sufficiently seriously. And then there's the health impacts of biodiversity loss. This is potentially the most significant. If biodiversity is lost, if species become extinct, if ecosystems start to collapse, when ecosystems collapse, so too do the societies that depend upon those ecosystems. It poses risks to food production, to regulation of air and water quality, and to even the ability to supply medicines. So we face this triple crisis, and it's a massive health concern. That is why the theme for World Health Day this year was Our Planet, Our Health. And finally, in terms of planetary health, we need to always keep in mind, I illustrated it with pollution, but it's certainly true of climate change and biodiversity loss, and just about any other factor you care to think of, that all of these impacts are inequitably distributed, that they will much more have an impact on people in low-income countries, in low-income communities and neighborhoods, and on indigenous, racialized, and marginalized communities everywhere. So there's a massive equity component to everything that I'm talking about today. So with that as context, I want to go back into the mandala and start not with the individual and family, which is where medicine tends to focus, but moving out through community to society to ecosystem. So let me talk with the idea of healthy one planet communities. I mentioned that globally our ecological footprint is equivalent to about 1.7 planets. We only have one planet. This is what it's all about. There are not any spare planets available, no matter what Elon Musk may fantasize. But in Canada today, we act as if we had this. There we go. We have an ecological footprint around 4 3/4 to 5 planets worth, which is massive. So in 2016, our ecological footprint was 4.7 Earths. If the whole world lived the way we choose to live, we'd need another 4 planets to sustain the people of the world, and that clearly is not going to happen. So what does have to happen is this. We have to become a one planet Canada. Our fair share of the Earth's biocapacity is 1 planet's worth per person. And this is going to require a 70 to 80% reduction in Canada's ecological footprint, about 1/2 to 2/3 of which is carbon, remember. So this is why I say we're not taking this seriously. We're not yet acting as though this is where we have to go and this is what we have to do. So how do we reduce our ecological footprint to the equivalent of 1 planet while ensuring good health and a good quality of life for everyone? Again, the equity dimension is crucial in all of this. Locally, and this was done here in Victoria and Saanich by Jenny Moore at BCIT, our footprint is a bit less than that, largely because we have a more temperate climate and 90% of our electricity is hydro, not fossil fuel fired. Nonetheless, this is our ecological footprint. Note that 44% of it at a local level, at a household level, this is based on household expenditure, is food. Transportation is over 1/4, and then you have buildings and consumables. These are the big areas of our ecological footprint. A lot of that is fossil fuel, but not all of it. So when we look in more detail at that locally, what we find is that almost 3/4 of the food footprint is animal-based: meat, fish, eggs, and dairy. Almost 3/4 of the transportation footprint is due to private vehicles, and almost 3/4 of the building footprint is due to operating energy. So those are the big areas where we need to make big reductions. And the good news, I'll come back in a minute to the good news. And to do that, we're working locally with the idea of One Planet Living and a One Planet Sandwich, which is a project that I'm involved with here. These are the principles from an NGO in Britain called Bioregional. They've been touting the idea of One Planet Living for 20 years or more now. They have 10 principles. What I want to highlight here is that the first 3 of those principles are not about natural environment and resources, but about health and happiness, about equity and local economy, about culture and community. So these are the really big issues. What we need to think about as people working in the health field is the health co-benefits of a more sustainable way of life. So a low-meat diet from a sustainable food system has a lot of health co-benefits, but it is also a sustainable food system. If you look on the right there, that is the new Canada Food Guide. It's quite consistent with a low-meat diet and with a sustainable food system. We know that active and public transportation is healthier than sitting in cars and sitting in traffic jams. We know there's a relationship between commuting and stress and air quality and lack of exercise and obesity and so on. And active and public transportation is the healthier option. We know that clean energy is the healthier option, whether it's for buildings or other uses. We know there are health benefits of building healthy buildings, which we have tended not to do. And we know there are health benefits of reduced pollution. All of these are sustainability issues that have health co-benefits, or if you like, they're health issues that have sustainability co-benefits. So we need to be working very closely with our environmental colleagues on this. We also need to be thinking about mental well-being in the Anthropocene. We know that young people especially are dealing with climate anxiety, with eco-grief. There is a condition that's been described called solastalgia, which is the mental pain of losing cherished landscapes. So when the Inuit see the ice disappearing, or when farmers lose their fields to drought, or when forests are burned down in fires, the people who live there experience solastalgia at the loss of those landscapes. We know about PTSD from victims of fires and floods and severe weather events. On the other hand, we know that we can improve mental well-being through nature contact. We know that we can improve well-being through engaging people in action to address these issues. So we need to be thinking about our role in addressing mental well-being in the Anthropocene. And we also need to be thinking about our role, because many of you work in the healthcare system, of what a One Planet healthcare system would be as part of a One Planet world. So you may or may not know of an organization called Healthcare Without Harm, a global coalition that's been around for well over 20 years now. And on the right is a report I wrote when we were setting up the Canadian Coalition for Green Healthcare, which I also co-founded back in 2000. And I did a big report called Doing Less Harm then. Healthcare, we need to remember, has an ethical duty to do no harm, and that includes no harm to the environment, because when you harm the environment, you harm human health. So we sometimes lose track of this, but actually healthcare is a massive part of the Canadian economy. It's about 1/8 of Canada's gross domestic product in 2021. And that means that it has a large ecological footprint. It's a large part of the economy. It therefore has a large ecological footprint. Depending on what you look at, healthcare causes environmental impacts between 1% and 5%. And more than 5% for some national impacts. And it also generates a lot of materials and a lot of wastes. These are some of the global pollution contributions from the health sector from a paper a couple of years ago now. if the health sector, if the health sector were a country, it would be the 5th largest emitter of greenhouse gases in the world. So I've just said that. So you might want to touch base with the Canadian Coalition for Green Healthcare and think about this and look at some of their areas of interest: resilience and adaptation to climate change, energy conservation, green procurement, green facilities, sustainable food, safer chemicals, waste management, water conservation, and green leadership. So I don't know to what extent your hospitals, health authorities, clinics are involved in addressing the health impacts of healthcare, the environmental impacts of healthcare, but you certainly should be. There's a national project now called Cascades that's also got started based at the University of Toronto Centre for Sustainable Health Systems. So you might want to ask, what is your hospital or health system's carbon footprint and ecological footprint? And you might want to look at doing the Green Hospital Scorecard that you can get from the Canadian Coalition for Green Healthcare. So I want to move on very quickly because I'm running up against time limits here. I recognize that, with a couple of final sections. I want to talk very briefly about the idea of a well-being society, and I am going to skip over some stuff here. But the key point here is that last December, the World Health Organization at its 10th Global Conference on Health Promotion created the Geneva Charter for Well-being. And it talked about the need, the urgency indeed, of creating sustainable well-being societies committed to achieving equitable health now and for future generations without breaching ecological limits. That is where we hope to be going. So they suggested 5 areas for a 21st century health promotion response to this need to create sustainable well-being societies. And the first is to value, respect, and nurture planet Earth and its ecosystems. The second is to design an equitable economy that serves human development within planetary and local ecological boundaries. And the third is to develop healthy public policy for the common good. Now, I am going to slide over some of my points here very quickly because I want to get to a final section to close this off. But this is the challenge that the UN Secretary General gave to us a couple of years, 18 months ago, when he said, making peace with nature is the defining task of the 21st century. It must be the top priority for everyone, everywhere. So how do we make peace with nature? And it looks like my system is, oh, there we are. One way to think about this, and this comes from the Truth and Reconciliation Commission, where they talked about the notion of reconciliation with the earth. And you'll see in that final sentence, this is a perspective that we as commissioners have repeatedly heard, that reconciliation, that is reconciliation between Indigenous and non-Indigenous Canadians, will never occur unless we are also reconciled with the earth. So reconciliation needs to include reconciliation with the earth, with nature. Second key point is that we need to design a different economy, one that's fit for the 21st century, one in which we recognize that ecosystems sustain societies that create economies and that it does not work the other way around. And one way to think about that that's gaining popularity is Kate Raworth's notion of a donut economy. The donut being that you need a big enough economy to meet the social foundation of well-being for everyone, but a small enough economy that you don't exceed the ecological ceiling. And that space between those two is what she calls the safe and just space for humanity, where we can thrive in balance. So we're going to have to rethink our economic principles and models. I'm going to skip over the absurdity of GDP and the need to measure inclusive wealth. the notion of developing healthy public policy for the common good is the third area of action in the Geneva Charter for Wellbeing. And these are some recommendations from WHO. There were many more than these, but these are some of the key ones from WHO for World Health Day. Some of the policies we need are to keep fossil fuels in the ground. This is a direct quote from the WHO. Stop new fossil fuel exploration and projects. Stop fossil fuel subsidies and reinvest those in public health, and I would say in clean energy. Repurpose agricultural subsidies towards sustainable and healthy food production. Implement policies to reduce food wastage. Build cities with green spaces, and so on. So we need to be thinking about healthy public policy. And I'm going to end it here. I'm not going to go through the next few slides, which explore this in more detail, but I do think that where I'd like to end is with this, that rediscovering a sense of reverence for and connection with nature is key to us being able to do any of this. That we need to remember that the first action area in the Geneva Charter was to value, respect, and nurture planet Earth and its ecosystems. So I'm going to skip over some slides here. My apologies, you can go back and see them later, because I want to get to a final couple of slides. These talk about our various ways of connecting with people and with nature. But where I wanted to come to is this. What is truly holistic and integrative medicine in the 21st century? I came across this definition when I looked at the website for the National Center for Complementary and Integrative Health at the National Institutes of Health. Whole person health refers to helping individuals, families, communities, and populations improve and restore their health in multiple interconnected domains: biological, behavioral, social, environmental, rather than just treating disease. That is the business that I've been in, and if you like, the business of making people whole. My website, if you look at it, talks about healthy people in healthy communities in a healthy world. This is my vision. This is the business I am in. I think it's the business of integrative medicine. And so thank you very much. And let's have some time for questions and discussion.
Wow, I think I'm supposed to ask the first question. Can you hear me?
Yes, I can.
Okay, I hope everybody in the theater, you can hear me as well. I gotta say, I am completely blown away, not only by the magnitude of the phenomenon and how huge it is, but by your ability to capsulize it. I've never seen it summarized so clearly before. I'll be very brief because I know there's going to be other questions. I'll just ask about the part that I know a little bit about, which is medical education, and particularly the undergraduate medical curriculum, which I'm most familiar with. Is there anything you can say about the current state of this topic within medical education generally, within the undergraduate curriculum, and exemplary programs that exist in Canada and the UK, in the US, elsewhere? Anything you could say and any guidance that you could give to curriculum planners and developers?
Well, I'm not deeply involved in medical education. I have to say, I always used to say, I taught at York University part-time for 20 years. I was full-time at U of Vic for 7 years. And I said, and meant it fairly sincerely at the time, that if you wanted to teach about health, it helped not to be at a university that had a medical school, because it distorts the conversation about health. That said, undoubtedly the curriculum has shifted a lot since I went through medical school 55 years ago. But the place to put this in is to integrate it with the social determinants work. So quite a lot is taught about social determinants, but we need not to be thinking about the ecological determinants over here and the social determinants over here as if they're somehow separate. They're integrated, they're enmeshed. One drives the other, and both ways, in fact. And so we need to integrate it and think about an eco-social approach. The Schools of Public Health, which is what I know more about, we did a survey led by Annalee Yassi at UBC a few years ago, 2 or 3 years ago, that was published. And while many schools of public health had core courses on social determinants, there was almost nothing on the ecological determinants. So it has been a gap. People realize that. Following our ecological determinants work at CPHA, there is a group called the Ecological Determinants Group on Education that has been working on this through the Canadian Public Health Association. So it's certainly a concern within public health, but it needs to be a concern across the entire field of health studies.
Thank you. Thank you. I'm going to remain silent for a minute because I'll see if there's other questions. I think Derek is going to be
Yes.
questions.
Thank you, Dr. Epstein, and thank you, Dr. Hancock, for that wonderful talk. We've got lots of interested folks in the audience here. Does anybody have a question for Dr. Hancock? Yes, we have one here.
Thank you for that excellent talk. I attended a wonderful presentation on planetary health from Dalhousie a week or so ago, and that really struck home for me was from a presenter addressing the issue of the effect of the burgeoning global population on damage to the planet. And what she said was, this is a really important issue, but she said, I get so upset when people talk about the need for population control. She said, I prefer to frame it as we need to educate and empower girls and women. And when we do that, the population will come under control. And not a specific question, but it was the first time I'd heard it framed that way. And I'm interested in your thoughts on that.
Was that Courtney Howard?
Yes.
I thought it would be. I know Courtney very well and saw her here in Victoria. In fact, just a couple of weeks ago, we had dinner. For those of you who don't know, Courtney Howard is a past president of Canadian Association of Physicians for the Environment and runs the Lancet Countdown for Canada. She's on climate change. She's very good. I completely agree with her. We actually had a similar discussion to that a couple of weeks ago, I think. The way that I put it is twofold. If you look at where both historically and currently the largest impacts on the planet come from, they come from high-income countries. There is massive global inequity in ecological footprint, for example, so that a child born in Canada is going to have an ecological footprint of 5 to 10 times that of a child born in a low-income country, possibly more than that. So we're looking at massive differences. So really, if you want to think of it in global impact terms, the population that needs controlling is in high-income countries, not in low-income countries. And as she said, the route to population control, which incidentally, globally, the growth rate now is about 1.1%, which is the same as the growth rate in Canada, though a chunk of our growth rate is migration, of course. But nonetheless, we're down to about 1.1% globally. The way that you get family size reduction is really what we should talk about, actually. The way you get family size reduction in low-income countries is, as she said, through educating women, engaging them in society and in the workforce, and that brings family size down. And for that, of course, they need development. So while we need to shrink our ecological footprint by 70 to 80% in the next decade or two, low-income countries actually need to increase their ecological footprint. So part of the point of our shrinking is to make space for them to grow. But also we need to be redistributing wealth and power, but particularly wealth and income. If you look at the inequities, look at the recent, late last year, the World inequality report that came out. And the levels of inequality in wealth and income are staggering. And of course, wealth is very closely tied to consumption. So we're going to have to learn to live more modestly in high-income countries.
Thank you for that. Any other questions? Nothing else here. Dr. Epstein, do you have any further questions?
On mute here. I will throw out something for discussion. And the term that I heard only very recently for the first time was the term eco-anxiety, and you touched on this. It strikes to me that my background and research background is studying human problem solving. And one of the big revelations in human problem solving starting about 50 years ago was that human problem solving is much more than just a cognitive process. It's a social process, and even more so, it's a very deeply emotional process. And it strikes me as the emotional component of this is absolutely huge. Like I say, I was just overwhelmed as I was listening to you and watching the slides here. Is there anything, it seems to me that coming to terms in a healthy way with the emotional content of what we're facing, both individually and as communities and as a global society, is huge. Is there anything you can say on that topic?
Well, a number of things come to mind. When I talk with my students about this, I would always make the point that you cannot make it your job to save the world. That will crush you. That you need to do what you're capable of doing, which may end up being a lot or may end up being very little, but be doing something. But you can't take on the responsibility on your own of saving the world. That's a crushing responsibility. What you can do is work with others. I love a definition from a couple of my medical colleagues from a few years ago, writing actually about Canada's healthcare system, but they use the phrase that hope is finding positivity in the face of adversity. And there is a lot going on that is good out there. We tend to focus on the bad news. It seems to be a very human trait. Bad news sells papers and good news doesn't. But there is a lot going on out there. We're looking at starting a project here called the Seeds of a One Planet Region. And the idea would be to identify local people, groups, organizations, businesses that are already doing the things that need doing and highlighting them. And in doing so in a way that people can find them, can be in touch with them, can learn from them on a local basis. So you could, in theory, if we get this going, click on the map and find the 6 places within 5 miles of you where people are growing their own food, or the 6 places that sell electric bikes, or whatever it may be. So I think that's a piece of it. Another piece of it is, and it has to do with the positivity, you have to have fun along the way. If it's not fun, then you probably shouldn't be doing it. You should find something else. So you need to find that. But taking action, as I said, is a massive antidote. And being out in nature is a massive antidote. Now, the trick around being out with nature, and one of the slides I didn't share, I ask audiences how many people have houseplants. About 2/3 to 3/4 put their hands up, and then I ask why. Why do we have houseplants? Why do we bring plants inside the house? And I think it's because of what E.O. Wilson called biophilia, our deep-rooted and innate need to have contact with nature. And houseplants, I think, are a simple expression of that. But being out in nature, and you don't have to go to the wilderness to experience nature. You can find it in a blade of grass. You can find it in a small patch of flowers. You can find it in the street trees. There's lots of places where you can find nature. We do need to bring nature into our lives and into the cities and into our neighborhoods. But those are getting involved in any or all of those sorts of things. So it's very simple things like even just switching your diet a little bit is going to make a difference. And I should say that I am not a paragon of virtue when it comes to this stuff, and I don't pretend to be. No one is perfect, or very few of us anyway. But we all need to start to make shifts, and small steps at a time is the way to get there. But I think we can find hope, and I think we need to find hope. You don't just find hope, I think you make hope. And so we need to make hope.